Hello and welcome to this presentation on postgraduate education opportunities at Ulster University. You're very welcome. You've obviously made that first step to think about where you're going in the future. My name is Una Carson and I am the course director for the Applied Health Studies suite of postgraduate programs. This is a completely online program with all teaching and resources available electronically. There is no requirement to physically attend the campus, but we'll talk a little bit more about that later. For now, what I want to talk about is the benefits of studying at Ulster University. And I suppose I'd start by saying that despite being a dot on the world map, Ulster University has a huge reach, a huge global reach, and we have over 200,000 alumni worldwide. So another benefit of studying at Ulster, if you've arrived at this presentation today, is that you've obviously taken that first step to think about maybe I should get further educated and where will that take me? So Ulster has a lot to offer you in terms of courses and programs. We do have excellent conversion courses for those who want to change their career. But I guess for me, one of the key parts of the Applied Health Studies programs is this ability to give you that competitive edge in your current area of employment, or perhaps in an area of employment within the discipline that you work in that you would like to move into. And this would really be where the strength lies in the Applied Health Studies programs. Obviously, additionally, there's always the idea of personal fulfillment. And I think that's it. That's proving yourself, not necessarily to other people, but very much to yourself. So there's that acknowledgement within programs of your potential and where you can take your career. We are additionally, obviously going to talk about the fact that in Ulster, you're taught by experts. You're taught by those people who have done it themselves, who have moved forward, who have progressed, who have that background knowledge, perhaps have done research in certain areas, but you're being taught by people that know what you're going through, know how your work works, and know that the impact that that has on it, and also the potential for you to have an impact on it. What we do also have, and I think it's really important that we perhaps sell this, is that one of our very important strengths is the support provided for students. And this is in terms of the physical environment, but also, and particularly in the Applied Health Studies case, that of the virtual environment. And that is in terms of our electronic resources, such as library facilities, the tools that we can use, like Collaborate that we're on at the moment, or like our videos, other tools and virtual packages that we provide in order to allow online learning. Ulster offers some combined programs, and this is particularly relevant in the School of Nursing. These often result in not just academic but also professional qualifications, and again that's across a range of programs, but definitely within the School of Nursing. We work closely with regulatory and industrial bodies and employers across all of our programs, and that's not just on a day-to-day basis, but it's also through the development of our programs, the development of our curriculum, answering the needs of services and answering the needs of particular types of employers. And we also have a designated employability and careers department to assist in that whole process. So we have a great group of people who are able to help you along that route of improving your prospects and progressing your career. And there has been research done on the quantifiable benefits of taking on postgraduate education. We know that money isn't necessarily the most important thing, but it does help. And research has found that £8,000 is the extra amount of postgraduate earns earnings compared to those who are at graduate level, that over a lifetime, a master's graduate can expect to earn 266,000 more. 20% of postgraduates postgraduate progress 20% faster than graduates in professional settings. And 90.7% of UK postgraduate leavers actually end up working in professional occupations, compared to 72.6% for total UK undergraduate leavers. So these are some of the sources, some of the research that kind of would hopefully encourage you to think about it, and actually probably has already encouraged you to think about how you move forward within your career. I suppose what's vitally important for me is that the Applied Health Studies programs are housed within the School of Nursing, and it would be wrong to not include the benefits of studying at the School of Nursing at Ulster University. This school is ranked in the top 50 in the World University rankings. The School of Nursing is ranked 6th in the UK and 1st on the island of Ireland. And we have really worked very hard as a team to get us there, to get us to that, between research and the services and the teaching that we deliver. Again, we've mentioned the academic and professional qualifications that are offered, and this is very much evident in some of the programs within the School of Nursing. We've also been awarded the Athena Swan Silver Award, and for those of you who don't know, that is a charter mark that celebrates good practice in higher education and research institutions, and it's about advancing gender equality. And we are at our Silver Award and hoping to progress soon to our gold. So if you decide to apply to Ulster, this is quite an easy process. You apply online. Most programs don't have an official closing date, so applications roll over. However, course places are very often limited if you're looking for specific pathways. The earlier you apply, obviously, the easier it is to secure your place, and to go through those application processes to make sure that when September comes, you are ready to go. You can apply for multiple courses, although separate applications are required. And obviously, it's really important that if you do submit an application, that you submit it completely, that you fill in all the blanks and send it to us. But if you're in doubt, please do contact the admissions office, and you'll get their details on the website, and they will be happy to help you in the process. In terms of fees and finance, taking on postgraduate education is an expense, so it has to be something that you really want to do. And as I said before, the fact that you're here probably means that this is something that you're quite committed to involve yourself in, because you are going to obviously have to commit some funding to it. So courses start from 6,270, and that's the fees for 2021 to 22. In part-time programs, very often what happens is that we look in terms of credit point fees. So for each credit point, there's a certain amount of cost, and that, dependent on whether you're doing 30 or 20 credit modules, that's what you have to pay. You multiply that up. But all this information is available on the website. And what Ulster has done is give you a number of options as to how you can pay those fees. There is a flexible payment option, which allows you obviously to use something like direct debit or standing order. There's also a discount if you want to pay your fees up front. This I have experienced a number of times in applied health studies, where particularly at the end of a financial year, some of the trusts or health services will decide that they have funding available, and they will put that funding up at the front to pay off the program, even though the student hasn't yet enrolled. So there is that potential for that to happen. Obviously, if you've already studied with us, there is a 10% discount as an alumni. And there is, of course, the opportunity to apply now for postgraduate loans. What I would say a note of caution is that if you want to apply for a postgraduate loan, I believe that that is a one-off event. So if you're looking to do postgraduate education, it's perhaps useful that you apply for a loan for the most that you need. So if you wanted to go in at postgraduate and apply for the master's, if you decide to leave earlier and not take up the rest of your loan, then that is it at least allows you to know that there is that capacity for the full loan. Sometimes people apply just for a loan for a postgraduate certificate, and I believe that the fees then, that the loan cannot be applied for again. So just be careful with that. Ask the appropriate questions at that point if you do want to take up a loan. So I'll focus in a little bit more specifically on the Applied Health Studies programme. The programme is aimed at all registered healthcare professionals. And when I say that, we're obviously housed in the School of Nursing, but we have more than nurses. We have physios, we have biomedical scientists, we have dentists, we have previously had occupational therapists. We have a range of healthcare professionals, and that is what our programme is aimed at. It is designed to help you develop that competitive edge within your current workplace, or so that you can move perhaps into another developing service or another role that becomes available. So it's designed to help you progress your knowledge to make you more competitive within your own workplace. Assessments within the programme are designed around your practice, so it isn't like we're giving you something completely new to go up and study on. It's studied, or it's designed around the work that you do on a day-to-day basis, and it really is about developing assessments that are in tune with what you're doing. So it may be that you do things like a reflective diary or a journal of events, and those are just one type of assessment that you might do within any particular module. We think it's really important that we embed the application of evidence-based theory to practice. So all programs have that element within them of looking at evidence bases, looking at research processes, and considering, you know, in developing that theory, how does that apply to practice? And I mentioned briefly at the start about the fact that it is a distance learning program. At Ulster, our fully online programs are designed to offer flexibility. We understand that healthcare professionals are busy professionals, and no less in the last number of years. And therefore, the online aspect allows you to broadly study around your lifestyle. While we do use loose timetables, and we do sometimes have synchronous activities such as webinars or meetings, the program is built in such a way that you can do it at your own pace within semesters. Our programs, we're very fortunate in Ulster that we have the experience of providing distance learning, and we've done that for some time. Ulster knows what works. We have very highly supportive and experienced teaching staff who have the experience, again, as I mentioned before, of teaching and of working practically within the area or the arena in which they're teaching. We have a vast range of electronic resources through the library, and we have a great department that supports students, particularly when they are online. So if you do have concerns about moving to that kind of vision of a program, please don't worry too much about it. We do have a great supportive department who will help you get online and get up to speed as to how you need to move through different scenarios to make sure you get the most out of your program. I mentioned before the assessments are designed around practice and around the application of theory, with this respect for the centrality of evidence-based practice. A vitally important aspect, I guess, is also to consider the fact that the Applied Health Studies programme is offered at postgraduate levels, but focuses in on pathways. So these are the pathways that are offered within Applied Health Studies: continence care, developing practice, neuroscience care, stoma care, and urology care. And I know people will look at that and say, those are a strange grouping perhaps of pathways. However, we have found at Ulster that in the continence, stoma, urology, and neuroscience care arenas, there's not a lot on offer out there. These are developed, these specific suites of programs have been developed as a response to a need that has been stated by health services, obviously not just within the UK or Ireland, but also globally around the world. These are not particular topics that are taught frequently in a number of places, and perhaps that's why you're here. Perhaps that's why you've actually come to Ulster, because you know we deliver these not necessarily frequently offered programs. I would also like to point out the developing practice pathway, specifically because the developing practice allows you to literally do that, develop your practice no matter where you're working. So perhaps continence care isn't your thing. Perhaps the other 4 pathways don't offer you what you want. What you can do is develop your theory and develop your practice totally related to where you're working now. And I mentioned before that, you know, we have people from different arenas. We also have paramedics in here who are using the likes of the developing practice pathway, because that relates completely to their place of work and their practice as it is now. So I suppose if I talk a little bit about the course structure, applied health studies is offered at postgraduate level in 3 different levels, I guess, or in 3 different programs, and you can enter and exit at all of the different stages. The postgraduate certificate is a total of 60 credits. This is made up of 2 30-credit pathway-specific modules. So you'll do those 2 30-credit pathway modules dependent on the pathway that you choose at the beginning of your program. You can do those 60 credits and walk away successfully after your year with a postgraduate certificate in applied health studies with your specific pathway named. Or you can proceed on to postgraduate diploma level. This move includes another 2 30-credit core modules, and by that I mean these are modules that relate to everybody no matter what pathway you're on, and they are specifically related to service developments and also to research, the process of doing research and understanding research. You can leave at that point. You succeed at this point. You can also leave with a postgraduate diploma. And that is basically your postgraduate certificate plus the extra 2 modules. If you decide to progress on, then you finish your final year or year and a half, depending on how long it takes you, with the 60-credit dissertation. And this allows you to do research in your specific topic area, your disciplinary area, based on the knowledge that you will have gained from the previous 2 levels. So, for example, if I give you an example of the developing practice one, you come in at the start in the first year and you do critical application of advanced compassionate communication in health and social care practice. That's one 30-credit module. And you do the second 30-credit module in developing practice through innovation. So again, this is about looking at what you do and how you best do it and how you can make changes or lead changes in your area. You would then go on and do the advanced methods in research and development in health and social care, which teaches you about methods, but also that understanding of how people research and how they come to the conclusions and the theory that we apply in practice. And the second 30-credit module is what I was talking about in terms of service, healthcare services. So global perspectives. What are the changes in terms of disaster relief, in terms of technology, etc. And then finally, as I mentioned in the last slide, you would do your 60-credit dissertation. And the previous 2 levels prepare you for that development and undertaking. Now, the program doesn't just happen by itself. I'm obviously the course director, but within that we have pathway leaders. And you will notice that there are Jerome Marley would be pathway leader for 2 of the pathways. Diane Little is the neuroscience care pathway leader. Dr. Donna Brown is for developing practice, and Janice Reid is for continence care. I've also mentioned here Dr. Lawrence Taggart, who is the dissertation coordinator for the postgraduate programs. And we're a tight little team, always available to students, always available to support them, and we work very hard together. And in fact, we've all been very active in the process of revalidating or renewing this program literally in July 2020. So this is a very new, refreshed program across all those pathways. What I did want to relate to was the fact that a number of the staff who are both teaching on the programs and also were involved in the development of the programs are also either current presidents, ex-presidents, executive directors on a number of professional organizations. So they have, you know, a great wealth of information from these specific areas as to what is needed or what is required. So we have an input. These are just a couple of examples of the professional organizations who have linked in with us in terms of specifically neuroscience and urology. But we have others that have also come on board. I wanted to include a few testimonials here, both actually emailed and also during conversations. I've had students that have actually come in either at the end of the program or during the program. What they have said is, you know, I've got my current post because I am doing your program. This program is what gave me the confidence to apply. So it's about giving you that confidence that you know your stuff, and that you know how you can progress practice and change services and lead those changes. Another, what I have learned on this module helps me to look at my workplace and understand what is happening and what needs to change. And I think this is a very strong issue that sometimes within practice we don't always understand why things are happening, but this program has obviously given this student the ability to kind of look at the theory and say, I understand why that happens now. And this was from an email a couple of years ago. A student said, I am pleased to tell you that my postgraduate certificate with yourselves has led me gaining a full-time post as a specialist nurse within the Health and Social Care Trust Community Brain Injury Services. So she had moved and progressed into that new role based on the fact that she had the postgraduate certificate. Now, obviously with COVID, there are preparations and there are things that the university has had to do. There have been changes, and I know, I would say, I suppose this isn't necessarily very relevant to the whole idea of online learning, but there are considerations that we've had to make this year, not in terms of how we deliver our program, but in terms of acknowledging what our health and care and professionals have had to endure out there in practice. And as I said, one of our selling points is that we are very supportive. We also do adapt things for students if that's the case, and we have definitely seen that in the last year and a half. We've had to sometimes be more flexible in our practices. Thankfully, COVID didn't really affect us in the practical day-to-day aspects, but I think we've had to acknowledge that our student population has been severely affected by it and work around that, and that's the joy of online learning. And finally, I just wanted to say, if you have any questions regarding postgraduate study, you can either get in touch generally with admissions or with the university. If you have anything that is specific to applied health studies, my name again is Una Carson. This is my email address, om.carson@ulster.ac.uk, and you can also see my telephone number there. You will find the details about the Applied Health Studies programme online on the course prospectus. Please do come, please do ask questions, and If you have any queries or any doubts, let us allay them for you. And thank you very much for listening to me today, whether this is in the seminar or online on the website. I do hope that you will progress and study your career with us at Ulster.